Hello, Assalamualaikum. We are from Group 3.
13.
We'll be present about botulinum toxicity.
Basically, botulinum toxin, also known as Botox, is a neurotoxic protein produced by the bacterium Clostridium botulinum and their related species. So, it prevents the release of the neurotransmitter acetylcholine from axon endings at the neuromuscular junction, thus causing flaccid paralysis. The toxin causes the disease botulism. It is also used commercially for medical and cosmetic purposes. Therapeutic use for botulinum is focal dystonias, which is involuntary sustained or spasmodic pattern muscle activity. It is also used for spasticity, which is velocity-dependent increase in muscle tone. For chronic pain and disorder of localized muscle spasm, non-dystonic disorders of involuntary muscle activity, strabismus, which is disorder of conjugate eye movement, cosmetic use, and sweating, salivary, and allergic disorders. There are a cohort study for this botulinum which have been done by a researcher. So the objective of this study was to determine patients' response from pre to post BTX treatment experience. The result from the study is show that 88% of patients were satisfied with their dermatologist. 65% of patients felt over 60% improvement in areas treated. 58% of patients anticipated making repeat visits, whereas the biggest concern for returning was due to the expensive cost. So the conclusion from this cohort study, this study correlated with previous studies done on retention rate of BTX cosmetic patients and satisfaction level of areas treated. The cost of BTX remained one of the primary concerns for repeat visits.
Good day everyone. I am Danish and I'm going to explain about the response of botulinum. So the first one is the effective dose. So the dose needed is about less than 400 units in 3 months interval. These are the examples of therapeutic use. The first one is overactive bladder, detrusor overactivity, and chronic migraine, adult upper limb spasticity, and also adult lower limb spasticity. So all of these examples, the dose is about less than 400 units and of course in 3 months interval. For the effective dose, it cannot be used within less than 1 month interval because it will be dangerous to our body. So the next one is toxicity dose. It is differ based on weight per muscle. The dose is more than 400 units and less than 2,500 units for 70 kg adult. So it will be different dose for different weight. If let's say 80 kg adult or more than that, it will be a different dose for that person. So the last one is a lethal dose. It also differ based on weight. The lethal dose for humans is 2,500 to 3,000 units for 70 kg adult, and it will be different for different weight. The last one is the lethal dose for animal. So the example stated are monkeys. So the dose is about 39 units per kilogram. This one is associated adverse effects. So the spectrum of possibility, which are drug-related effects, aesthetic use effects, and also therapeutic use effects. For the first one, drug-related effects, it can be typically causes by high doses injection and also a booster within less than 1 month. The effects are like bruising, headache, allergic reactions, psoriasis, nausea, and others. For the second one, which is aesthetic use effects, the effective dose is about 6 to 400 units. The maximum dose is 400 to 600 units, while the lethal dose is 2,500 to 3,000 units. The most common reported cases are mild and transient, which are injection site pain, erythema, bruising, headaches, and also prolonged migraine. The treatments related to these aesthetic use effects are eyelid and brow ptosis, lips asymmetries, eye sensory disorders for the upper face, and also imbalances for the lower face. The last one is the therapeutic use effects. It involves neuromuscular junction, internalizing by spinal cord motor neurons, and fast axonal retrograde transportation. The major effects are death, anaphylaxis, dysphagia, respiratory insufficiency, and also muscle weakness. All of these major effects are systemic events and rare, which is observed with underlying medical conditions predisposing to the complications. The example, which is from cases reported on 3 patients, the treatment of their dystonia with therapeutic doses of botulinum toxin resulted in clinical muscle weakness distant from site injections. It is speculated that the repeated injections at intervals of 10 to 12 weeks, as in their patients, may have impact on toxin binding and also diffusion.
Hello, my name is Naiem, so I will explain about precaution of using botulinum. First, make sure you use the right dosage. Second, storage of botulinum should be in 2 degrees Celsius to 8 degrees Celsius. Check the expiry date before use, and knowing side effects such as nausea and vomit, difficulty swallow and chewing, drooping eyelid and blurred vision, like sensitivity, edema and muscle weakness. Not all can use botulinum. Some group of people need to avoid from use it, such as patients with motor neuron disease, myasthenia gravis, Eastern Lambert syndrome, and others. Need to avoid from use botulinum because they have contraindication with botulinum itself. Next, patients that consume medicine to decrease neuromuscular transmission. The drug is such as penicillamine and quinine should avoid from using botulinum. For everyone information, botulinum are included in Act of Poison 1952, which prohibit from sale to person under 18, and botulinum toxin are categorized in Group B in Poison List, first schedule section 2. Poison and drug under Group B should not be sold to any person except sellers and supplier of the poison itself, and registered medical practitioner, also licensed pharmacists. All the group above should be rating, signed and dated by prescriber, state the address of prescriber, state the name and the address of patient, indicate the total amount of medicine to be supplied on the dose, specify numbers of time medicine may be dispensed with duration of interval. All these need to be take note.
For the conclusion, botulinum toxicity is generally considered to have a wide safety margin. However, there are also inherent risks. The risk can be divided into 3 categories, which are reaction to the medication, such as the allergic reaction, overdosing, and poor injection technique, which can cause damage to the skin. Botulinum toxin is the most potent toxin known. Extremely minute quantities like pictograms are potentially lethal in adult humans, which can lead to death.
That's all for today. So we hope that you all understand about botulinum toxicity. These are references if you want to check further and explore further about botulinum toxicity. We wish you the best luck. Thank you.